Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Pet, Pune. Today, let us discuss what are the 5 common misunderstandings about IVF in people's mind because of which they refrain from taking the treatment from the IVF consultants. Now, we know that test tube baby technology is a relatively new science of medicine which has emerged in the last 20 to 30 years successfully all over the world, and India also boasts of great success rates in IVF ICSI technology, which gives very good reliable pregnancy rates. As we know, because of changing lifestyle and so many other factors, around 30 to 40% of the couples are infertile and need to seek treatment for IVF. Now, whenever a patient is undergoing test tube baby, she has fear in her mind. There are so many misconceptions, misunderstandings, so many hearsay talks or Google studies and all. She has already searched so much that the patient is already very apprehensive to go and approach the doctor who is a fertility consultant. Let us today discuss about the 5 misconceptions or misunderstandings in IVF. First and foremost, IVF is always painful. It is absolutely not. Because of advancement in technology in painless injections, now we get laser pens which are available with DNA recombinant technology which are absolutely painless. Even the patient can self-administer the injections and she can continue to do her professional as well as personal work. Second misunderstanding, bed rest is required. Now, there's real good news for professional women that it is not required. You can continue to do your job as well as outside and your personal work. These injections can be taken even at home. The injection after you get pregnant as well, not a single hour of bed rest is required, and you can continue to do your own work for all 9 months of pregnancy. Third misconception, IVF gives rise to abnormal children. Now, this has been proven beyond doubt that IVF does not increase the chances of abnormality. In fact, the first-born IVF baby, Louis Brown in England, has herself delivered her daughter, and there is a second generation which has also proven that test tube baby gives absolutely normal children. In fact, the pregnancy and the abnormality rates are not related to IVF technology per se. The fourth and the most important thing is that it is always very expensive to do test tube baby. Now, we do agree that because most of the media disposables are imported from outside, test tube baby is one of the expensive treatments in India. But if we see the test tube baby array or available options, there are 5 to 6 types of technologies, which ranges from the basic IVF technology, which will cost you around ₹1,00,000, to the highest technology, that is ICSI with a frozen blastocyst embryo transfer, which will cost you 2 to 2.5 lakh rupees, and certain other investigations like PGS, PGTA, if we do, will cost you another ₹1,00,000 more. So it all depends on what is your reproductive score, and depending on that, what technology will be applicable will actually decide the price at actuals. Second thing is, because it has to be very transparent, you can ask your doctor about the exact nature of expenses which can be known well before you start the treatment, so that the patient is not strained for economic burden or any sorts. The most important thing which mainly takes the patient away, or she's afraid or she just doesn't want to go to the IVF consultant, is mainly fear in her mind. There is nothing to be afraid of. Suppose you're not well, you have fever, etc. If you do not seek the correct treatment, you will not get a proper treatment and you will not have a healthy life. So in case you want to have a baby, get yourself tested, get your partner tested, have a scientific and a legal treatment modality to follow, which will give you a child as soon as possible. Thank you.